for. Food allergies can be real scary for some trick-or-treaters tomorrow night. Dr. Richard Shaffood joins us this morning to talk about a movement to help keep them safe. Dr. Shaffood, happy Halloween. Thank you for being here.
Charlie. Great to be here.
So we see the orange pumpkins. We've talked about it on the show, but let's talk about it again.
Yes. So the Teal Pumpkin Project, Charlie, actually began as a grassroots effort in East Tennessee and has become a national movement. And what this signifies is food allergy awareness. Teal is the color for food allergy awareness. And,
okay.
You know, we know that food allergies are a significant health risk. The CDC tells us that the food allergies have increased almost 50% over the past number of years. And the food allergies, half of those allergies are serious allergies, anaphylaxis, where children end up in emergency rooms.
My kids don't have any allergies, so I don't have to deal with this on a day-to-day basis, but I know that in their classrooms, as we're getting ready to plan their Halloween parties, we have kiddos that have allergies to avocados, they have it to nuts, and it's dangerous.
It can be very life-threatening, and certainly, you know, in the United States, it's estimated every 3 minutes a child goes to an emergency room from a food allergy, half of which are life-threatening.
So you do this trick-or-treating where it's all about the candy, and you get these baskets and trick-or-treat. And obviously, parents have to watch out of what's in their basket. So tell us about the Teal Project and what parents could be looking for and how you can make a Halloween just as special for them as well.
Of course, Charlie. So the Teal Project is essentially to notify people that are trick-or-treating that the homes that they're going to have something besides candy. Could be, you know, a toy or some other type of. Exactly. The problem with the foods is the small types of candies oftentimes do not have ingredients listed, and they're made differently or in factories where there are food allergy factors. So this is another great reason to have this project.
I love that you brought some non-candy samples of what you can do, and I'm thinking maybe we'll do that one year, because how much candy could one kid get?
Exactly.
Is that good for them? Is that good for all of us? So what are some of the things? Let's come over here, and then, you know, these, you could go to
little toys that, you know, little stickers, bubbles, rings.
Bubbles. This is a really good one.
They are.
Do bubbles. What else is in here? Stickers.
Rings. All kinds of different items.
Oh, look, how cute are these? So you just get the, and I think the kids would actually, when you look at a basket full of candy, and then you see one of these in there, they'll get quite excited about this.
They can get very excited about it.
Okay, big day, trick-or-treating tomorrow. Any last-minute tips that you want to offer us before we go
Charlotte, the important things besides the Teal Project is make sure that if you're taking your child out, you have a flashlight. You're watching the traffic signals. You're looking for food that's been tampered with. Some of the candy may not be wrapped completely. Make sure you go to neighborhoods where you actually know the people. And again, you want to inspect whatever you pick up for your child. Obviously, if there's a food allergy, look for the Teal Pumpkin Project.
Dr. Shaffood, thank you for being here. You know, we did a story that parents eat more than half of their kids' candy.
I'm probably guilty of that as well.
I know, right? Can I start with this now? I'm like starting to take it. Thank you for being here. Put it down, Charlie. 1, 2, 3. See, I'm good. SUV sales increase.